an answer, and someday we will know, and we can ask them why they had to go. We live and die, we laugh and we cry, and we must take away the pain before we can begin to live again.
Hello, I'm Margie Fincham, a registered nurse. I've been working in the area of death and dying for most of my life. I was born on a farm where the cycles of life and death were normal occurrences. And I believe that an individual can prepare for a peaceful death. It is the unknown that creates fear. When fear is transformed through knowledge and love, it creates a peaceful environment. The idea for this video began shortly after my husband's death. From his diagnosis to death was 10 days. The experience that my children and I had with my husband's death was very peaceful, loving, and a confirmation for me that one can prepare for a peaceful end of our lives. The following excerpts were taken from my interviews with patients, physicians, nurses, an attorney, a funeral director, and family members whom I encountered in my nursing practice. They all had knowledge that they were willing to express about preparation for a peaceful death. I think of allies as those who help in the process of transition from life to death. The individuals in this video will be identified on the screen by their first names and their roles as an ally. As you watch and listen, I encourage you to reflect on your own beliefs about death. How could you prepare for a peaceful death?
People in the family that are approaching these stages, and we're picking up the signals. And I know we're going out of our way to do things that we wouldn't normally do because we want to be in a position where we can help those people, be there for them, maybe allow them to clear with you so that the transition isn't as great for them, so it's easier for them, so that, as you put it, you can just let go.
And so begins the task of preparation, of learning to let go peacefully.
The unknown, not knowing what to expect, what they're going to go through. Those are many of the questions that the patients have for us, What can I expect? What will the end be like? And we try to explain to them in a layman's way what to expect for both themselves and the family. And I think that helps them through the process a lot. Knowing what's coming up, they are much more at ease.
We live in a country where we come from various cultures, and most people who come from certain European cultures and certain Oriental and Chinese do not want, their families do not want the patient to know of the diagnosis, which makes it very hard. But initially they start off that way, and as the disease progresses, most patients are informed. I would say a great majority of them are told of their disease, their prognosis.
There are two categories of patients. There's one category of patient who do not want to know. Then there's another category where the family will not let you tell the patient what's happening. And that is what I find very difficult, because I prefer to inform the patient about his disease process. I like both the patient and the family to know.
As you heard, these professionals believe that knowledge is helpful as it relates to an individual's death. It allows an individual opportunity to prepare, to have some control with the eventual outcome. Now we will hear recommendations on the best place to complete the cycle of transition.
You know, at the turn of the century and until World War II, really, most people died at home. I mean, that was the reality. And it's only in the past 20 or 30 years that people have come into the hospital for terminal care. And I should say it's not terminal care so much as it's medical scrambling to do something, even though death is imminent. Now, recently, there's been more of an emphasis to focus on true terminal palliative care. And this approach is more on the hospice lines. That would be creating a multidisciplinary healthcare team, symptom control, pain management, bereavement counseling, nursing services, social work, chaplain services. And I think that gets mimicked in the hospital, but the reality is I think that's best done at home. So I think terminal care or hospice care or palliative care, I would prefer to see at home, if at all possible, because I think with good home nursing agencies or a good home care hospice program, that's the optimal setting. And I think if you look at the legislation with Medicare, the reality is hospice is defined as terminal care for patients irregardless of where they live or where they are. However, the focus is truly on home.
I think it depends on the situation and the family. Most patients prefer to be at home. They are in a familiar environment, something they're used to, and they're more comfortable in that setting. They're near their loved ones. So whenever possible, we would prefer that. If they could be home, that would be the ideal setting. There are certain situations that if there are, say, very young children in the family, and it would make it difficult for the young ones for one of their parents to be dying at home, then we say we'll keep them at home as long as we can. And towards the last few days, if they had to be transferred to the hospital, we could do that.
We are as involved with the patient as we are in the hospital, but it's much easier on the patients because they're taken care of at home. I don't think it makes my job or my responsibilities any easier.
Our doctor realized that the last few days it was quite a job for Mother and me and to handle the situation, and he slightly suggested that maybe we we bring him back to the hospital or so, but we said no, we can still do it, and we never thought of it, and it was good. So it really was. I was all in all, it was a wonderful experience. It enriched my life, definitely.
Several years later, this happened to us again with my mother-in-law. She too died from cancer, and we had to take care of her, brought her into our home and took care of her through her last final days and tried to make every day count.
Well, I was nursing in a hospital and doing acute dialysis nurse, and a month before I was married to my husband, he was diagnosed with lung cancer. And at the time, the doctors gave us 6 weeks if we were lucky, and that's all I would have him. As it turned out, Roger, who was my husband, was really into being creative and eccentric, and he wanted to try all these holistic approaches. And my feeling was, well, if I'm going to lose him anyway, why not go ahead and try it? Since then, I've changed my mind. I've learned a lot. We traveled all over the world. We were in Japan for a few months. We were in Mexico. We did the Hoxitonic Clinic. I had my husband 4 years. He went into 3 remissions. Because of that and because of the way we were treated, I started a home care agency, and now we do a lot of work with cancer patients.
There is actually no way out. It's hard to tell someone, you know, that to convey that there's no way out, and it's just it just has to happen. There is no way out, and you. And if you resist that, it's just everything gets worse. I realized that this was priority number 1. Create calmness, peacefulness. I wanted to be with him, and I had the time to do it, so this was a very good opportunity. And I just wanted to do it. I wanted to be with him and with my mother and support both of them. I was wanting for all of us to handle this the correct way. I think it was very important once I started to talk to Dad about dying, always, and also calming down Mother to say it's all right. I mean, this is how this whole process has to go on, and it's all normal.
Although my husband died in the hospital, I established a hospice-like setting in his room with the permission of his doctor and the hospital staff. Our 4 children and I took turns making sure that he was never alone and that his physical needs were always met for pain and emotional comfort. One can prepare the home for a comfortable death as well. Such items as a hospital bed for ease in changing positions, raising and lowering the head of the bed, a bedside commode, and lots of sheets and pillows are all useful. If the doctor has ordered hospice, the hospice nurses can assist in getting the appropriate equipment for the dying individual and the caregiver.
Their emotional needs are very, very high. The expectations start off being very high, and as they get closer and closer to their end stage, it becomes very difficult to deal with them. Dealing with their emotional needs is very difficult. It's a difficult chore, both on the physician's part, on the family's part, and the other people who are involved in their care.
The next interviews describe the range of emotions experienced by a caregiving family. Tracy was in her early 20s when she began her fight with a cancerous facial tumor.
I thought she was attacking me, but she was angry as she was like hurting. She was in pain, and I learned that Mom goes, Christy, she's not mad at you. You're the only person, me and you are the only person that she can get mad at, because, you know, it's like that means she loves you a lot, because she can be, and let her do that to you. You know, take it. You know that she doesn't mean anything by it. And I used to just cry like, oh my God, she hates me, or she's upset with me, and I realized I was one of the only people that she can do that to. You know.
When I came down, I was scared, and I drank a lot during that time. If you really care for somebody, to not be overly concerned and just live it on everyday situation as best you can.
She got an operation, and you know the doctors are pretty optimistic that this is going to be the one, you know, to get rid of it. And again, we'd have a disappointment. It'd come back, and the thing would grow out again. And you know, the family would be devastated. And she would just say, "Oh, we just deal with it. We just go to the next thing."
I think if I could ever pass on any advice to somebody, is sit down and talk to them and tell them how much you love them. And
something you didn't have a chance to do with your brother.
Well, he knew it, but you know, the words weren't passed on. I mean, you know, they weren't, the words didn't come out, but I never had that talk with him, you know, and he knew he was going to die. And but he was never told, which you made a remark before. I think they should be told. If they, you know, and his sheet was marked terminal. And I don't know if Tracy's sheet was ever marked terminal. I didn't see it, but someone saw my brother's. But I always wished that I could have had a talk with him, you know. But I learned from it. Tracy, I wanted to have that talk with Tracy, you know. So one day at the beach, I think it was maybe 8 months before she died, she was in good shape, you know, she was real good. And I pulled her aside and I said, you know, I know you're going to make it, but, you know, I would just like to tell you, you know, how a joy you've been to my life.
I think a lot of people go into a feeling of denial when they find out that someone's sick and that they possibly could die. And for me, I'm a workaholic when it comes to denying things, and so I went into working and keeping the company afloat for the family and everything else. And I think that that's needed, but I think what I would have done differently was put the work aside and hold his hand and spend quality time with him. And complete with him. And even during those times when he might have been slightly delirious or a little bit out of his body, so to speak, and in a lot of pain. And I just wanted to be with him, you know, because it was during such a time of helplessness and knowing that he was not able to do anything about his condition and that I wasn't either. And there was just a feeling of sadness that was there that I didn't acknowledge, and I don't think he acknowledged either. And I wish we had.
My mother never told us that he was dying. Well, I could see him progressively get worse, not doing as well, contacting more. He had the flu more often, and he had bronchial problems, and not knowing what the problem was as we got closer to his death. There were little signs probably that I didn't pay attention to. But I realized that something else was going on then. So I said, Dad, I want you to know that I love you.
From my observations of death, I have noted that as an individual nears the last moments of life, some rather predictable responses occur. People experience intensified pain, which can be controlled by proper pain management. Or they show no pain at all, when previously they had been in pain. Other individuals may again express fear of being alone or facing the unknown.
I was not frightened by them. I talked to the hallucinations or illusions or whatever you want to call them. I talked to Dad about them. And I told him, you know, you're imagining those things. And after about 5 times my saying that, and he telling me of a scene again that's happening in his bedroom, he looked at me. He could still talk then quite well. And he looked at me and said, well, I think I'm just seeing it, am I not? And I said, yes, Dad, you are. And then he accepted it, so he actually knew it.
As a caregiver, there are many ways that help can be given to the dying patient. Some are physical, some emotional. Some are preservation techniques for both patient and caregiver. Underlying all of the desires to help is the basic gesture of love. This is transmitted between all individuals. And, as I mentioned earlier, it is the foundation of a peaceful death.
One of the biggest things that I didn't think it was a big thing, but Tracy thought it was a big thing, was she would be laying down a lot, and she would either spit up or she just, you know, she had a lot of, she'd blow her nose and be kind of messy. And I'll just be sitting on the couch and I just grab a hanky and wipe her off her face, and just those little things, but which to me was just human nature, you know. She couldn't do it, or she, you know, didn't want her to move, so I would just wipe off her nose and stuff, and she'd just be real grateful.
That's true, but you know, Scott, how many people are afraid to do that?
Yeah, well, I didn't realize at the time, but since that time, you know, Mom told me how many times Tracy acknowledged it.
They wouldn't tell us when he was alive how long he would live. After he died, they told us. They said that it was a miracle that he lived as long as he did, and that it was incredible what you were able to do, and the only reason why he survived was that the love and the care. We required the best care for him, and so sometimes we had to complain with medical staff or people that didn't give the quality that we thought was necessary and was needed, and so we had to fight for a lot of things because some people became complacent. He wasn't the cute little baby that would laugh and talk back, and so they'd leave him in the room. Actually, in the hospital, he got aspiration pneumonia because they didn't provide the care. He got better care at home than in the hospital. That's why, if at all possible, we wouldn't put him in the hospital. And we realized we've got to care for him or have people that love him. Like the nurse that was with him when he died that was with us. She was part of our family. She called him her baby. And that's what we needed, and that's what he needed, that we could give that. Even the doctor that, you know, asked us, do you want to take him home or when I'm hospitalized? And I said, I'll take him home. Even when I called him on the telephone, because it was planned and he'd seen a doctor, we could just call the mortuary or funeral home to come pick him up. And it's like, when I called him, he even cried on the phone with me. And it was just real rewarding to know that these people cared, and it made a difference in their lives too.
Things seem to go easier. The tensions, the stresses, getting up very early in the morning to take care of feedings and medications, and then going to work and then coming home. We discovered that it was easier when we were able to have laughed at something. And at some points we would actually seek out that which would make us laugh. We went to movies, we'd pick out comedies. It's like, what comedies are playing right now? Because we didn't want to see anything heavy duty, or we didn't want to see an action blowing up buildings, that kind of thing. We wanted to see something that would make us laugh.
The biggest thing is to go with your heart and your feelings. If a doctor or medical people make a recommendation to do something, get a second, a third opinion, study, research, and see what's going to work, what's going to be right in the situations. It's not always the same. Not everybody's the same in the family. You've got to make the decision because you have to live with it. I mean, one of the hardest things was for us to have a no-code order. I think as a parent, you have to live with whatever the decision is. So you have to come up with it within the family. Who is your family? What's important to you? And really research. And the doctor isn't God.
I think there's a sense with physicians that if you can't actively treat someone or actively pursue a cure, you failed the patient. And ultimately, I think doctors may feel they failed themselves or the medical profession. And I think if you refocus on the issue of that you're caring for a patient, the caring doesn't stop. The curative intent may stop, but the caring certainly doesn't. So I unfortunately hear too many times family members say, who comes in second opinion or it comes to a support group, the doctor said, I have nothing else to offer you. Totally untrue. Totally alienating to the family. And the reality is they do. They have hospice service, they have palliative care services, they have so many other things they can offer. Maybe the physician isn't comfortable offering them or isn't focused in the sense that there is something further. And I think with more of a multidisciplinary approach, there's going to be other people reminding the doctors that there are things.
The next interviews feature some of the more practical things that can be done at any time in one's life. Each of these elements takes away fear that comes from decision-making under crisis.
I've always thought of myself as a patient advocate. I was always doing whatever I needed to do, even before I ever went to law school, when I was a nurse at the bedside, going through the hierarchy or arguing with whoever I needed to argue with to get what the patient required. That's always how I thought of myself when I went to law school and became an attorney. I just thought of it as an extension into another area and another forum as my role as a patient advocate, from bedside to courtroom. The confusion that I have found at the bedside and in my practice in either the living will or the durable power of attorney for health care is that people don't understand, either the patient, the family, or the healthcare provider gets a little bit confused and thinks that once you execute this document, that this document once and for always speaks for you. Well, that's simply not the case. The real situation is these documents only come into play and only speak for you and only take over if you are in a situation or a condition where you can no longer speak for yourself. If you are in a state where you're confused or you cannot speak for yourself, such as a coma or Alzheimer's disease or some other kind of senile dementia or some other condition which renders you incapable of making informed decisions about your health care, the durable power of attorney for health care can jump in there, and what it does actually is appoint an agent to speak for you when you can no longer speak for yourself. And that agent that you appoint through this document is the person that stands in your shoes as your representative to either give consent or withhold consent for certain kinds of medical procedures. So it's a little more complicated, and it takes a little more thought about what you really want and what you don't want to do that, because essentially what you're doing is giving all your power of consent away to another individual. Unlike the living will that comes under the statutes for the Natural Death Act, the living will only jumps in for you if you have a terminal illness. And the only thing that physicians and healthcare can do for you is to prolong the process of dying, or to prevent, well, it's not prevent, but forestall the inevitable, which is your death. If you're in a situation like that, such as you're in imminent, death is imminent for the patient, the living will can jump in there and say, I really don't want to live hooked up to tubes and machines and all kinds of devices, and the living will allows the physicians and the healthcare providers to essentially pull the plug. If you are in a situation where, even though you may be terminal or you may be critically ill, if you are still conscious and competent to make an informed decision about your health care, then neither the living will or the durable power of attorney for health care are effective. They are silent. As long as you are speaking and capable of giving your own consent or withholding your own consent, then these documents are silent. And I think that's some area of confusion for everybody in the community and in the hospital as well.
Having your legal affairs in order ahead of time plays an important role in preparation for a peaceful death.
Not to be put on any kind of thing that would prolong my life. I mean, hoping that I am just on the threshold and can go, which I want to do. And then I told the people that were involved, and I told my relatives, all of whom are not geographically anywhere near here. And then I told the people near here, such as the manager of the apartment who would come in, and my neighbors, and anybody else who wanted to know, so that it would make it easy for them and easy for me. We have pass keys. My neighbor has a pass key, and the manager, of course, has a pass key. So after they come in the door, they are able to look at the telephone, which shows not to call CPR or do anything, or the paramedics or anything that would prolong it, and also to look in the closet. On the breaker box, I have written out a whole dossier of who my relatives are so they can call, and who my doctor is, and I made arrangements with the mortuary so that when they come in, they will be able to see what to do and know that that's what I want to do, and I hope it'll make it easier for them.
Another aspect of a peaceful death that I have observed on many occasions is the need for permission to die. My first experience of the importance of this issue made a profound impact on both my career as a nurse and later as my husband was dying. Other professionals have made similar observations.
So we'll take them aside and we'll talk to them and we'll say, you know, we understand that you want this child here, and this child is fighting going over, and it may be within your power to provide them with that last gift, because they know you're unhappy. They know that you want them here, but their peace is on the other side. And if you can get the ability and the courage and the love to go in there, take their hand, hold them, kiss them, and say, it's okay, you can go, I will be all right. The family has to accept, and give permission, you know, so that they, and then there's like a general peace that comes over the individual. You know, they were bucking the ventilator, they were beating the odds of the machines. The machine said, you should be gone. But no, they were there, they were pulling, they were breathing. Every inch of their body showed this tremendous fight, as if they were not ready to say goodbye. And they need to have that permission, and once they receive that permission, then they can cross on. The mother actually asked the doctor to discontinue the code. And as they stepped out of the room, and then she turned to me and she said, I would like to prepare her body. And nurses looked at me and I said, we will prepare her body. So she and I together washed her daughter, you know, to get her ready for going downstairs. And that was a moment I will never ever forget. You know, as you know, we gently bathed this young girl. I watched the mother fully caress her, fully love her, and say goodbye. And I watched her bring each family member in to say their goodbyes, because we prepared the body for viewing. And then the mother and I walked out in the hall together, and I just held her in my arms and let her sob for about 20 minutes and just stroked her back. And I thought to myself, there but for the grace of God go I.
My mother noticed that father stopped breathing, and she came rushing out to me and she said, please come. And when I came into the room, there was this big quietness, this big silence, because he had been breathing quite hard. And I realized that he had died. The past few days, he just refused to close his eyes, maybe 2 days. Maybe he was trying to hang on so hard, I don't know. He always looked. And many, many times, you had the feeling he was also looking at you, and he knew it was you who was standing next to his bed. So his eyes were open, and I closed his eyes. He was looking at me because I was sort of lying on the side. And I closed his eyes, and they stayed closed. And his mouth was open and didn't look so nice, so I put up his chin with a scarf. Yes.
Those are practical things.
Yes. And also I saw that his arms were across his chest, so I put them straight down.
See, those are wonderful kind of physical goodbye gestures.
Yes, and maybe I did something else. Maybe just symbolic. It is just symbolic, of course, but I opened the door to the garden and let the day get in. And maybe his soul get out, I don't know. Leave his, so his soul could get out. I learned there that dying is part of living. Dying belongs to living just as much as all our activities, really.
My family has always looked upon the arrangement for funeral services as a normal process.
Most parents, especially parents of this generation, my generation, that have young children, grew up at a time when death was a taboo subject in the United States. We didn't talk about it in school. We didn't talk about it anywhere. We didn't talk about it at home. We didn't talk about it in church or synagogue. And as a result, we are often perplexed about how to help our children deal with the death of a pet or the death of a grandparent or any other significant person. These kinds of resources are available free of charge from nearly any funeral home in the United States, I'm certain. One of the ways you can check is to pick up the phone and call and just ask the funeral home in your community, do you have some free resources that are available? It is perfectly acceptable for a family to ask if there's some question or if they're not understanding. Funeral costs vary very dramatically across the United States, not only by region, but from funeral home to funeral home. And it is not only acceptable, but is a good idea for a family to call around before there's a need and find out what costs involved. The community funeral directors in the place where they live are great resources of information. Because as a profession we deal with death and bereavement every day of our lives, often we have seen and in many cases even written the resources that are used nationally to help people through that time, whether it is planning ahead or whether it is dealing with the aftermath, the grief and all the things that go with it after a death occurs. In addition to helping families after a death has occurred, is helping families deal with the inevitability of death before it occurs. One of the things that we find is that families often spend a great deal more money than they have to because of the emotion of the moment after a death actually occurs. Planning ahead is one way that families can reduce the cost, usually, and almost always is a way for the person who dies to make his or her wishes known about the kind of service options that he or she may have chosen. In addition to those things, planning ahead relaxes everybody after a death occurs and helps people know exactly what was preferred.
Earlier, the doctors spoke about their belief that an individual should be told about their prognosis. Peaceful end-of-life transition requires communication. For prolonged illness, support groups for patient, caregivers, and families may be the format to begin the process of honest communication.
And the bereavement process may in fact be brief, it may take years, it may in fact be appropriate even for people that are going to be cured of their cancer but rather are faced with this otherwise ominous diagnosis. And I find with the support groups, many people will participate in these that otherwise wouldn't have thought that would have been appropriate for them. And I think you're finding more and more people that are seeking support groups as an avenue to vent feelings and share. And probably the thing that I see most at support groups is sharing of information.
We have heard the personal experiences of how to prepare for a peaceful death. Now let's hear about the benefits of preparation.
If we really love somebody, no matter who it is in our life, that there's a part of us that's there, that will always be there. And so we're a changed person with that, to remember the good times, the quality, how did they change our life, make it better, and remembering the positive times with that person. And then, in turn, what can you do? How can you reach out to help others?
It was an overnight decision that I had to change the thrust of my life, but it was years in making the transition, and I'm still in a major transition. I think it was Bernie Siegel who said that life is a process, and it's an ongoing thing. And I think that once you realize that and accept that this is always ongoing, that major changes in your life become not so distressing and not so emotionally disturbing.
I think the more interested you are in life, even though life and death are the same thing as far as I'm concerned, you're just making a change. You're going through the butterfly kind of a stage. I think I am prepared. The last 12 years of my life, I've gotten more prepared for this because I believe that I'm trying to keep my life as squeaky clean as I possibly can.
Some people that don't know Tracy, I'm just like, I feel so lucky to have been in her life, that she taught me so much every day.
Making every day count is so very important.
I sincerely hope that my goal to bring you information regarding a peaceful death has been helpful and reduced some of your fears. As you may have sensed in the speaking, these individuals all expressed a sense of love in what they were saying. In healthcare, professionals have to love their work in order to do what they do. This love is intensified with each observation of a loving outcome. The feeling of love that comes from seeing an individual or family peacefully help their dying member transition from life to death is a most tremendous gift. Who would you choose to be your allies? Would your family and friends know that you have prepared in some way for your own death? I hope that someday you will share this knowledge with others and be an ally in transition.
There is an answer, and someday we will know, and we can ask them why they had to go. We live and die, we laugh and we cry, and we must take away the pain before we can begin to live again. So let it start, my friend, let it start, and let the tears come rolling from your heart. And when you need a light in the lonely night, carry me like a fire in your heart. Carry me like a fire